Hi, I'm going to talk to you today about charity care in Chicago and how that works, since it's kind of a complex issue, but I'm going to do so using Legos. So, how does charity care work? Well, I'm going to explain this using a scenario. So in this scenario, we have Bob. This is Bob. And Bob is a single parent with 2 children who works a minimum wage job on the near west side to try to make ends meet, as well as trying to watch his kids. Sometimes he gets extra job, but nonetheless, Bob has a minimum wage job and he doesn't have any insurance. So one day, Bob is biking down Clinton Street when all of a sudden, out of nowhere, comes a car which hits him. The car then speeds off, making this a hit-and-run accident. So the police and the ambulance arrive to get a statement and to also take Bob to the nearest ER. There are 3 ERs closest to where Bob's accident happened. The first one would be the University of Illinois Medical Center ER. The second one, Rush University Medical Center ER. And the third one, the ER at John H. Stroger Jr. Hospital of Cook County. For the purposes of this video, and so I don't have to say John H. Stroger Jr. Hospital of Cook County dozen times in this video, we'll just call it Stroger. So, the ambulance drives to the Illinois Medical District, and for the purposes of this video, we'll only talk about Bob going to Rush University Medical Center or to Stroger Hospital. So, the paramedics unload Bob at Rush University, and it turns out, when it comes time to look at Bob's financials and also to see if he can pay the bill, it turns out that Bob is eligible for charity care. What charity care means is that if someone in Bob's financial situation, which at Rush would mean that Bob's income level is 300% of the federal guidelines for poverty, Bob is eligible for charity care, which means that Bob here, here's Bob again, see, probably has some stitches in him. Bob never has to pay a penny. The hospital accepts that this is a loss, and it's unreimbursed health care, complete write-off. This would also happen if Bob were taken to Stroger Hospital. They would also look at Bob's income level, and Bob would be able to not have to pay his medical bill. Now, there are also different levels as to how people get financial assistance with health care. At Rush University, for example, you're able to get up to a 70% discount depending on your income level. There are also options such as a discount if you're self-pay. Some hospitals will help you with programs through Medicaid. It depends on the hospital. For more information, I recommend you look at hospital websites. Right now you're probably wondering, well, couldn't a hospital just say, Bob's uninsured, he can't pay, can't that hospital deny him the right to be treated? Well, let's examine what would happen in that scenario. So, in the scenario that would be proposed, Bob would be taken to Rush University Medical Center, and Rush University Medical Center would say, well, we won't treat Bob because he doesn't have health insurance and he can't pay. Take him to Stroger, that's where the poor people go. Disclaimer, you don't have to be poor to go to Stroger Hospital. So the paramedics would probably walk Bob's stretcher over to Stroger Hospital. It's pretty much right next door to the new Rush Tower. And he would be treated there. Under federal law, that's illegal. So, what would happen in that case would be that, let's say this is an administrator at Rush University, is that hypothetically if this happened, the federal government would go to Rush University Medical Center and say, you committed patient dumping, which is the term used for when a hospital denies someone the right for treatment because of their color or because of their ability to pay or lack thereof. Well, the federal government, which will be represented by this police officer, goes to a hospital and says, you committed patient dumping, you have to pay up. So then this now sad administrator at Rush University Medical Center would have to give this police officer money. It should be noted this is a $100 bill, and a fine for patient dumping is never as low as $100. Also, I would like to make a disclaimer saying that this is not to suggest Rush University Medical Center does any patient dumping. In fact, Rush University Medical Center is trying to treat as many people as possible, and part of their transformed hospital building was to better serve the community on the west side. Just clearing that up. Now, there are some situations that are different. For example, let's say Melanie here. She has a nice drink from a nice cafe in Hyde Park. She has become pregnant, and she has no insurance. Well, there are programs through Medicaid that would cover her hospital expenses since she is a pregnant mother, and some hospitals would be willing to pay to help Melanie out with this. Doesn't matter if she goes to Stroger Hospital or if she goes to University of Chicago Hospital Medical Center, this will be taken care of. Thank you. Meanwhile, but also there are other situations that could help people get better care and save hospitals money. For example, Vlad here, if he walks into the University of Chicago Medical Center ER and he has a cold, they're going to give him a referral to a primary care physician so that he can get some appointments with that primary care physician, because the University of Chicago Medical Center realizes that a patient coming in for a cold really shouldn't be there in the first place. Seriously, kids, don't go to the ER if you have a cold. And that they should do their best to try to help people get primary care. The same thing would happen if Vlad walked into the Rush University Medical Center, because Rush University Medical Center and probably also University of Chicago want to improve healthcare in the communities they serve. I hope this answers some of the questions you might have about charity care in Chicago. For more information, read my article. Thanks!